Hi, this is Doreen Skolnick. I'm the clinical social worker at Gaylord Hospital. I work on the neurobehavioral unit. Today we're going to be talking about the emotional effects of stroke. And what we're really going to be addressing is for the caregivers of how to respond to some of the emotional issues of having someone who has a stroke. We're going to really be going through some of the most common symptoms that happen after a stroke, but one of the things that I want to emphasize that people don't pay enough attention is the emotional changes, because we're so caught up with talking about the physical changes. Half of all the stroke survivors will experience some level of depression or mood change. And what we need to remember, and this is why I always want to bring it back to the caregivers, mood change are also very common and very much an issue for the caregivers. So let's go through some of the more common effects of a stroke. First, depression, which we refer to, and we're going to go back and explain that in detail. Then anxiety, and we all know about anxiety, mood swings, apathy, and each one of these things, just to go over, we'll explain in more detail, and then low self-esteem. And these are the more common emotional effects, but some of you might see other things, but these are the things that we commonly see after a stroke. All right, so we're going to start. First one is depression. And all of you is aware of depression to a certain degree. What I want to do today is really help you define, and so you sort of know the difference between what we often refer to as a clinical depression or an adjustment disorder with depression. And so depression and stroke symptoms often overlap. But what we're really looking for for clinical depression is a general low activity level, sleep problems, okay, difficulty controlling their emotions, and a general lack of initiation. So some of the things that we as clinicians are looking for, but we also want you as a caregiver, because we rely a lot on what the caregiver are seeing, because you might be seeing it on a different level. So we want you to have a better understanding of what we're looking for and when we get concerned about depression. So the first part is it's a persistent, sad, anxious, empty feeling, okay? Next, the general hopelessness, pessimism. Next, a certain sense of guilt, worthlessness, helplessness. Irritability, anger. Restlessness, a general loss of interest in activities or hobbies once pleasurable, including sex. Now, this has to be a change from what was before. So if they have some of it, now, but you have to think about where and what was their baseline. Fatigue, decreased energy. Problems concentrating, remembering details, or decision-making. Insomnia, sleep is a very big issue, okay? Early morning wakefulness or excessive sleeping. So it's really what we're looking for at both ends of what we consider a concern, all right? Overeating or appetite loss. Again, both ends. Sometimes it's a person who cannot stop eating, and sometimes it's a person who eats and doesn't eat at all, okay? Again, depression. Next is persistent complaints of aches, pains, headaches, and some of it could be real, but some of it also can be a very clear sign of depression, all right? Less attention to personal grooming. Again, what we're always looking for is if this is a change from where they were before, all right? And the next one is suicidal thoughts or attempts. Now, before we even go on, I want to be very clear, everybody's going to have this to some degree during this period. The issue is if it continues, all right, if it goes on, and if we see that sense of hopelessness, worthlessness that's going on for more than a few days, it is not just the adjustment disorder with depression, it really becomes a clinical depression, and we get concerned. All right, so now, if you see depression, and you're hearing from us that we're worried about depression, what does it mean for you as a caregiver, and where do you go, all right, and how can you help? First of all, basic, give emotional support. You need to show that you understand, and you need to be patient and encourage them, all right? They need to hear from you, you get it, you understand, you acknowledge their feelings, you know how hard this is. You have to come up with, because often they think they're not hearing them, they need to hear, all right? Next is remind the person depression usually fades with time and treatment. So they need to know that too, all right? This is going to get better. all right? Let them hear that, particularly from you. Talk and listen carefully. Just the fact that you're talking to them is so, so important in this process. Again, acknowledge feelings, point out realities, offer hope. Hope is the best medicine, so we always want to offer hope. Involve the stroke survivor in activities, all right? Maybe there's something going on at home that they can be involved in. That's always, again, that's hope, that's future-oriented. Those are the kinds of things that we want to see, all right? Avoid sharing personal stories of depression. That's not going to help, okay? So that's, I mean, some people will say, oh, but I know someone. All right, that's not going to help, all right? And last is avoid using, I know how you must feel, all right? Again, what we want to do is make them more positive and future-oriented. All right, so next one is anxiety. All right, we all know about anxiety. We've all had anxiety in our life. I mean, we can think about anxiety before when you were in school and you had a test, you get a little anxious, and maybe it might make you study a little more. The great father of psychoanalysis, Sigmund Freud, says anxiety actually produces growth and change. So we have a certain amount of anxiety, but now anxiety with a stroke person is different because sometimes they cannot control it or they don't know what to do and how it comes out. So we really need to look at that. So first is, let's look at how anxiety comes across in a stroke patient. First of all, they might have that constant physical tension, all right? And that's very, very important to note, all right? And you're kind of wondering, and again, a certain amount of anxiety is normal, but it's a little more with a stroke patient, all right? There is that excessive worry and racing thoughts. Also classic with any kind of stroke patient, but it's something that we have to pay attention to, all right? They might be a little bit more jumpy and irritable, okay? Anxiety, but anxiety in a stroke patient for a period of time is worse, okay? They have that racing heart, okay? They can have excessive sweatiness, shakiness, all of those kinds of things. Again, classic, but also a certain amount of anxiety is normal, but this is after a stroke, all right? And last is when anxiety doesn't get controlled fully, there is a panic, all right? They always feel that doom is coming, panic. You've heard the expression panic disorder that comes from what excessive anxiety. Okay. So obviously there's a lot of behavioral issues that we need to talk about. Mood swings, all right? So mood swings happen classically after brain injury where they are up, down, and all around. So for example, they can be laughing 1 minute, sad the next minute, and crying. And you might look at them and say, what is going on here? What you have to know is this is very, very common. This is classic, all right? They haven't gone crazy, all right, or anything else. This is common, unfortunately, after a brain injury. We see the mood swings, okay? There is that emotional response that does not fit the situation because sometimes you think that they should be very sad and they're not showing it. Or sometimes they should be happy and they're crying. Okay, so that's what we mean by the emotional response doesn't fit to what is happening right now. You might be telling them some very sad, tragic news, and they are laughing. Again, classic after stroke, all right? And sometimes when it's last thing, it says unexpected shows of emotion. We use the term lability. They're all over the place. Again, what you have to understand, okay, as the caregivers, these are very, very common. All right, we have the mood swings. It takes a while until they get themselves to a better place. It does get better, but for a period of time, it's very, very hard for the caregiver. All right, so what do you do if you walk into the room and they're all over the place with these mood swings? Again, very, very important. You have to reassure them. You have to show reassurance because sometimes they know they are not controlling their emotions. You need to help them control their emotions, okay? You also have to remain non-judgmental, as opposed to maybe you thinking to yourself, they seem crazy. You have to sort of say, it's okay, it's okay. They need to hear that. Also, please remember the sudden shifts in the mood also can be part of their symptom of their stroke. So it's not a matter of something's going on, this is part of their stroke, and that's very, very important. Also, something that we all use here as part of the team and your therapist is redirection. Distract. So we want to distract them because sometimes they get caught up, they perseverate on something is, Let's, get them to talk about something else. Talk about it's going to be Thanksgiving, it's going to be a holiday, whatever it is, just move them away, which helps with those mood swings that we have found over and over again. So, something else that people don't realize that's also when we talk about behavioral changes and everything else is apathy. So what I'm going to try to do is define what apathy means and why that's such a concern, okay? There are different kinds of apathy. There is what we refer to as emotional apathy, there's cognitive apathy, and there's motor apathy. So what does it mean? And how does it manifest? And what would you see? And again, what we're trying to do is if you see it, to normalize. This is very normal. These are the normal things that people see post-stroke. So for someone with apathy, and again, remember what we're trying to say, this is normal, okay, is sometimes they have a lot of difficulty with initiating because you're trying to, they're supposed to go for therapy and everything is an issue. Classic, that's apathy, all right? They operate in that blah range, okay? They're not high, not low, they're just kind of blah, all right? Apathy. All right, so it's not them. Sometimes families get mad because it's kind of like, why aren't you doing it? Part of that is apathy. You need to understand that's a behavioral challenge, okay? There's that lack of motivation. Again, classic apathy, all right? And that they easily lose steam. Maybe they might start wanting to do something and then it's just, it peters out, classic. All of those kinds of things that you're seeing are all signs of apathy. It's not them not wanting to do something. That's an emotional change after stroke. It's very, very important to remember this is a normal response, all right? This is very, very common. So what you want to do is give them some gentle encouragement, okay? You do not want to be critical. You want to be non-judgmental. You also want to give the person some form of structure that will really help the person do better. And last is sometimes you might have to recognize they might do better when working with someone else, like a therapist or somebody. And that will also be part of their recovery. Some of the other interesting things that we see in terms of behavioral changes after brain injury is there's often a change in self-esteem. And remember, their body is not working right. They're not able to do what they want to do. That changes their self-esteem. So what you might see, there might be those negative statements. For example, I'm worthless. I'll never be normal again, all right? Then they don't have interest in their personal appearance. For someone who used to be meticulous about how they dressed, their hair, their makeup, and all those things, they don't have interest anymore. And with that also you see that social withdrawal. People might ask to visit and they say, I don't want any visitors, all right? Classic, all right? Very common things. And part of it is everything has changed. Everything's been hit upside down. And that sign is, I'm not enough anymore. What do you do when you see somebody who's also saying that they're worthless and has changes in self-esteem? So how can you as a caregiver, family member help? Well, basic, some of it is common sense, but we need to always go over it, is you need to encourage those feelings and expression of those feelings. When they sort of saying, I don't feel well, you want to try to make them feel better, okay? Always what we were talking about before, you want to redirect. Redirect is a very important tool that we use over and over. You want to redirect them to any positive thoughts, okay? You might also, even when they're saying that they want to not see anybody, you want to try to encourage them to see any people because that's very, very important to them doing better, okay? Also, next is help the person in terms of their goals. All right, how are we going to get better? What do we need to do to get better? And setting up realistic goals. For the person who says that they want to walk out of here, well, maybe you will, but not day one. So let's set up more realistic goals because maybe that will also help with their sense of self. And that what we always want to do is help with their sense of self. And also try to figure out activities that all of you can do together that might really help with this whole process. Thank you so much for watching.